Thank you for having me today. I'll be speaking about tips for treating ice pick, papular, and hypopigmented scars. So these are my full disclosures, but they are not relevant to my talk. The objective of this lecture is very straightforward. We are going to talk about 3 challenging type of scars, how to treat. And let's start with the ice pick scars. So ice pick scars are known to be very difficult to treat because of the nature of the scars. They are narrow and very deep. So the scars can extend beyond the depth of typical conventional laser technology. And they have a very small openings on the skin surface, which means that our fractional technology may not really target the center of the ice pick scars. So far, the treatment of choice is a cross method. Can you raise your hand if you have used the cross method in your practice? Yeah, I see, yeah, about 50% of people. Yeah, so what is cross method? Stands for chemical reconstruction of skin scars, which was proposed by Korean dermatologists. And their first paper was published in derm surgery more than 20 years ago. And I was very lucky to be trained in this technique by the authors of the paper. Basically, you are creating very well-controlled chemical burn inside atrophic scars by using high concentration acid and a sharp applicator. So I applied 100% TCA to the normal skin. You can see that it creates protein precipitation and necrosis up to 1,700 micrometers, whereas our typical fractional technology, especially non-ablative one, can go to about 700 to 800 micrometers. And these are before and after photos in the first paper. After the initial publication, this technique had gained a lot of attention in several countries. But several years later, we started to see these case reports of side effect, widening of scars from the cross method, which mainly was attributed to too much TCA solution inside very, very small scars. So you can see the overflow of or spillover of the TCA to the surrounding tissue. So these are the applicators published in the literature. I am using insulin syringes in my clinic, and I'm going to show you how I prep it. So I usually use a 31 gauge needle, a syringe, and then I draw up about 0.05 to 0.1 cc, very small amount. And then I remove a plunger, which allows the TCA solution to flow through the needle under just gravitational force. So you may wonder, oh, is it gonna drip? Actually, the 31 gauge needle is very small, so unless you touch the needle to something, that there is no dripping. And then I stretch my patient's skin like this, make sure I gently touch the needle tip to the inferior border or lateral border of ice pick. I wait until all the chemical reactions are done, so there is no overflow. You can see this white frosting usually within 10 to 20 seconds. Make sure, and then I move on to the next one. So this slide really highlights the difference of the frosting size when we use a wooden applicator, toothpick versus insulin syringe. So these are, so cross method can be used as a monotherapy, but it can be combined with various modalities for scars, including PRP injections, subcisions, and various energy-based devices. My patient, sorry for a little bit lighting difference, but this is before and after 5 sessions with a cross and fractional 1540 laser treatment. When I combine 2 methods together during the same session, I typically begin with the cross method first to ensure that the protein precipitation, chemical reactions are done, and then I use energy-based devices. My concern is that if we do opposite, then swelling from the laser treatment may potentially cause a further spreading of the acid than what I want. So I usually start with the cross and then laser. And here you can see that the size of the frosting really hasn't changed before and after laser treatment. This was my patient, only one session after cross and fractional 1540. This was a photo after cross and picosecond laser fractional technology. My Asian patient who had a very severe ice-pick scars and multiple boxcar scars, I combined with a fractional CO2 and cross during the same visit. So you would question if cross is really safe for skin of color patients. The existing literature basically is very reassuring with no significant complications in skin of color patients. So now let's move on to papular scars. Papular scars are not rare, very distinct, but somehow under-recognized. When you do skin check, you can see slightly hypopigmented, tiny papules, usually on the shoulders or upper trunk. That's actually papular scar, which also can happen on the center of the face, nose, and chin. So why do we get papular scars? Collagen may vary, increase, normal, or decrease, but the key histologic finding is actually the loss of elastic fibers. The middle and the right side, these are Verhoef-Van Gissen stain. You can see under the papular component, there is no black-colored elastic fibers. And we have a disease called anhedoderma. People lose elastic fibers from various reasons, and they present with slightly raised soft papules. And papular scars are basically anhedoderma secondary to inflammation around the hair follicles from acne. So you develop tiny, slightly raised papules. So far, 3 treatment options have been published in the literature. Dr. Sang-Ju Lee in South Korea, he published the first paper of treating papular scars. And Dr. Lee used a pinhole technique with erbium YAG laser continuous mode. And then a subsequent report used a continuous mode of CO2 laser from India. So I got this video from Dr. Lee. Basically, you are using continuous mode and then creating very tiny tissue ablation within the scars. The second technique, we just got the paper about 2 years ago. They used a regular electrocautery, and they basically ablated the epidermis and a little bit of dermis just within the papular scars. I have to agree with the authors of this paper that special caution is warranted, particularly in patients with skin of color. I think this technique may cause dyspigmentation. So if you are treating skin of color patients, but you don't have continuous mode of erbium YAG or CO2 laser, then please consider a needle-guided radiofrequency technique. So 2 papers came from India. They basically touch the papular scar with insulin syringe, and then you contact the radiofrequency or electrosurgery tip to the needle. And you basically create a very focal coagulation within the papular scars. And this was before and after 2 treatments. So last weekend I did a just very fun experiment with Dr. Karam An, who is a dermatologist in South Korea. We checked all the modalities with a tissue mimicking thermochromic phantom gel. This pink color means about 60 degrees Celsius. So you can see that the second one, electrosurgery, we are creating a lot of tissue ablation and coagulation in the surface. Insulin syringe with the electrosurgery technique, the third one, you can still see some damages in the skin surface. The last one is actually monopolar radiofrequency with an insulin needle, and you can kind of create a very nice coagulation zone in the dermis, but which actually spares the epidermis. So this might be a good option for papular scars. Lastly, let's review a technique to treat hypopigmented scars. We published this case series just about 3 months ago. Patients developed hypopigmented scars from various reasons. Right side after having laser hair remover and Medispa, in the right top after using IPL, right bottom after using home glycolic acid pill. So basically we want to increase melanin within the scars, And there are medications for glaucoma called in prostaglandin F2 alpha analog category, bimaroprost, latanoprost, travoprost. People used on the eyes and then develop dark circle as a side effect. So why does it happen? Is that prostaglandin F2 alpha binds to a receptor, and then with the downstream of PLC and CREB, MITF is going to be activated, and which increases the level and activity of tyrosinase and TRP1 and 2, basically stimulates the melanin production. So we have medications, but we also have devices to enhance the drug delivery, including microneedling, fractional non-ablative, and ablative lasers. So let's see what happened to our patients. So she got this hypopigmented scar. She started to use bimaroprost twice a day, noticed a little bit of repigmentation, but she received 1550 and 1927 at the same time. And after the laser treatment, bimaroprost was applied, and patient kept using it twice a day for 4 weeks. This is 4 weeks after one treatment. And this patient, actually, we did the same technique, but required 3 sessions. My patient, I also prescribed bimaroprost, and then she received the 1927 twice. And she also kept using it for like several weeks, and this is 8 weeks after the second treatment. Okay, if you don't have a fractional non-ablative or ablative lasers, you can actually use a microneedling. The right side is a photo from our paper. We did a microneedling and then applied the tissue marking ink, black color. And you can see that through the channels created by microneedling, the ink can be penetrate to the dermis. So the left side, a patient actually used a microneedling. I believe that was 0.25 millimeters, 8 times with the bimaroprost, and fully repigmented. So take-home message for ice-pick scars, please consider using cross technique. However, using a sharpened applicator, very, very sharp one, is key. And for papular scars, we want to create very focal thermal damage, and you can use electrosurgery with a needle. And for hypopigmented scars, fractional laser or microneedling assisted prostaglandin F2 alpha analog delivery could be a good option. Thank you.
Thank you very much.